Okay, hello everyone. My name is Crystal Dodwell, and we are here today to welcome you to the Master of Public Health information session, brought to you from the National Centre of Epidemiology and Population Health. So now I'm going to pass over to Matthew Kelly, who's the program convener for the Master of Public Health. So I'll just welcome him on screen and he is going to take over this presentation.
Hey, thank you very much, Crystal. And thanks everyone for coming along to the talk today. So as Crystal said, I'm the convener for all of the public health teaching actually in our school, which, as you'll see in the coming slides, includes a Master of Public Health graduate diploma and a graduate certificate of public health. Next, thanks. So also, as Crystal did mention in the introduction, in ANU overall, we pride ourselves on doing research-led teaching. That is certainly the case in our public health teaching. The National Centre for Epidemiology and Population Health houses some of Australia's leading public health researchers, and they will be the people teaching you if you do come into one of our programs, and our centre is ranked well above world standard for that research profile. Go through some logistics of our public health teaching programs through the slides coming, but the basic first steps are that you can enter halfway through the year or at the start of the year. We have semester 1 and 2 intakes. The Master of Public Health is a 2-year program if you do study full-time. Part-time options are also available. We'll come back to the prior learning recognition a little later, but just to basically say, if you have a previous bachelor degree or higher degree in a cognate discipline or something that can be considered related to public health, then you can complete our programs more quickly. And almost all of the courses in our program can be studied online or face-to-face. We have various teaching modes. Each course is a little different, but there's always an online option for those who are not in Canberra or who are working, can't come to campus, those sorts of things. So very flexible delivery. Next, thank you. Okay, so just going to step back a bit and talk a little bit about what public health is before we get into the details of our teaching programs. To sort of differentiate public health from clinical medicine and sort of hospital-based health treatment, we look at public health as the health of populations. We're looking at health, what aspects affect the lives of individuals that impact their health, but also how patterns of those health outcomes are distributed across the population. And also public health is promoting healthy lifestyle to prevent health impacts occurring for individuals. So we also in public health do research on health, disease and injury prevention, but also non-communicable and infectious diseases. This is a list of areas that the Masters of Public Health concentrates on. This is just an introductory list. There's many other areas as well. I like to think that everything in society affects health. We have a strong focus on social and cultural determinants of health, how public health is driven by factors outside just individual behaviours as well. So we look at the climate, environment, society, culture and health and all of these things as well. Next, please. So those are the sort of thematic areas that we teach in, but as well as those health areas, we want you to know a little bit about the skills that you will learn, which will then allow you to analyse data, interpret research findings and contribute to those thematic areas from the previous slide. We do have a statistical component to public health and epidemiology, where you'll learn the basics of biostatistical data analysis. But we'll also have a social science aspect where we learn how to interpret societal and behavioural causes of disease, but also to understand global health and how the health of individuals is linked with society in an upstream and an individual manner. And you'll learn some research method skills as well. We'll talk a little bit in further slides about the research aspects to the Master of Public Health. But in all of the courses that you do, you will learn research skills and how to solve complex public health problems. Next, please. Okay, so these are the two variants of the Masters of Public Health program that we run. They're both taught together. All the students are in the same courses together. The main difference is that the Master of Public Health program is 4 semesters of coursework only. If you're full-time, you can study part-time as well. Whereas the Advanced is 1.5 years of the coursework and then a half a year or 1 semester research project. But as I said, they're all taught together apart from that final research project. Next, please. So these are the admission requirements. We consider the advanced version with the research component has a slightly higher entry point GPA. But as you can see in the final point there on this slide, if you do gain entry to the coursework or regular MPH and you want to transfer to the advanced version to do a research project later, that is possible if you maintain a 70% grade. And as I mentioned earlier, we have a generous credit for prior learning process. If you have a previous bachelor degree in a cognate discipline, which we have the list here, you'll be eligible for up to 1 semester of credit. And if you've done a previous higher level degree, you can get up to 2 semesters of credit, meaning you complete the MPH in 1 year. So the list of cognate disciplines here you can see is fairly broad, and I think that reflects what I was saying about public health earlier, that we consider that political science and anthropology and studies of human society are as relevant to public health as having studied biology or medicine previously. And we consider them as disciplines that you can gain credit for prior learning for your previous degrees in those areas. Next, please. So as I mentioned earlier, we have a variety of public health degrees in our school. We do have a graduate diploma of public health, which is a 1-year program, but we don't offer that as something you can enroll directly into. We can call this an exit award. That means if you get halfway through your MPH and can't finish for whatever reason, then you can exit and still get a qualification for the work you have done. Next, please. And the other variant of public health teaching that we offer is a graduate certificate of public health. And this one is only 1 semester, so it's only half a year. So that means we have the half-year graduate certificate, 1-year graduate diploma, or 2-year master's programs to give flexibility across what people are looking for study programs. Unfortunately, the graduate certificate is only offered to domestic students at this stage, and the graduate certificate can be a stepping stone towards doing a Master of Public Health. So some people who are not definite that they want to do a whole 2-year program in public health, you can do the graduate certificate for 1 semester and then decide to then move into the master's program, and you would get that 1 semester of credit towards the master's program. As with all of our teaching, it is available fully online. Next, please. So yeah, this is similar information again, but the graduate certificate, it can act as an entry point to the master's program because it has a lower GPA entry point as well. So it's easier to access. And then if you successfully complete the graduate certificate, you can, as I said, you can use that as a pathway into the master's program. So I think it can be useful as an entry point for people whose GPA may not be sufficient to enter the master's program straight away, or for people who are just wanting to try out some public health learning to see whether they want to commit to a 2-year program. So that's the graduate certificate, diploma, and master's program. Next, please. So we do have a large internships program. We consider Master of Public Health in a way is a bit of a professional degree. It prepares people for the public health workforce. We'll talk about some of the career options in the next slides. But as part of that professional development, we consider it a priority to have internships available for students, and that we organise and facilitate those through the college and our centres offices. We offer internships. Obviously, health departments are probably our primary focus for this sort of internship work. But other government departments that deal with health as well sometimes have internships available. ACT Health is our local Canberra health department, and they take on a lot of our interns as well. The Australian Institute of Health and Welfare is a government-run but independent body that collects all the public health data in Australia, and they're very generous with taking on interns as well. So many opportunities, and there's others that are not listed here. It is possible even to organise ad hoc or personalised internships based on people's particular interests. So if you do come to ANU and enrol in one of our degrees, we can have a discussion about where you might be interested in doing some personal development through work experience. Next, please. So I often get asked this question about careers in public health, and it's actually a tricky one to answer, and that's because public health, public health is involved in all different facets of society. So people who have public health experience, yes, they can go to work in government departments and be health officers for government, but there's also a multitude of NGOs nationally and internationally that work in health development and just development work more generally. Can work for organisations like the Australian Department of Foreign Affairs and Trade, or international organisations in development such as the World Health Organization and places like that always employ people with MPHs. Health promotion, as I've mentioned earlier, is a huge role for public health workers, and health promotion happens at all levels of government, and again in NGOs and different types of organisations. Hospitals employ public health specialists as well. And when we talk about government as well, government down to the local level also employ public health specialists. Environmental health specialists, for example, are quite prominent at the more local level. So I won't go through every one of these, but just to the point I want to make clear is that there's a huge range of places people go with a public health degree, and our program will give you the capacity and the skills to move into any of these types of organisations that we have listed here. Next. So these are some of the employers that we have identified from our alumni where people have gone to work after finishing their MPH. As I said, in Canberra, ACT Health is a common pathway for people. The Cancer Council, Heart Foundation, Diabetes Australia, these sorts of non-governmental groups that are active in health promotion and lobbying government and doing their own research, those sorts of things. They're very good employers as well. The Department of Health is the federal department there. So we have, in Australia, we have like local council, and then state and territory, and then federal health departments, all good targets for employment, and many more. So as I said in the previous slide, there's many places who organisations that employ our graduates, and I'm happy to discuss these options with you more if you come to Canberra or get enrolled. Okay, so this is one of our happy graduates here. Ferdy completed his MPH last year, and he's now applying for PhD programs in a few different universities at the moment. So he's written a nice statement about his work with us, so I'll let you read that in your own time. But as an example of a international student who came to Australia, did an MPH and did a research project within that MPH, and is now pursuing a further career in research. Thank you. Next. Okay, so that's the end for me. I'm happy to answer any questions here, or I'm happy for you to email me with questions about our program and how it works after this session if we don't get to your questions today. Okay, so thank you, everybody.
Perfect. Thank you so much, Matt. So what we will do is we do welcome questions from the audience. So I'm just going to stop sharing my presentation just to see if there's anything in the Q&A. So I'll just give a little bit of time for anyone in the audience to ask any questions that they may have. I'm sure, you know, as Matt has gone through what the Master of Public Health is and what public health itself is, I'm sure some of you are considering, you know, different aspects of that and what you would like to do. I'll just kick off with a question, though, just to get the ball rolling. Can you tell us maybe some of the current research projects that some of the students are working on in your current cohort of MPH?
Okay, great. Yes, I certainly can. Yeah, so when people come to do their research project, you know, we have a whole list of options on our website of what different researchers are working on in our centre, and people can look at contacting researchers. So some students that I'm working with at the moment are looking in Indonesia at smoking prevalence. Indonesia has one of the highest smoking rates in the world. And they're looking at changes over the last 10 years in smoking prevalence in Indonesia, and the impact of sort of anti-smoking messaging. Trying to measure the impact of how we can best promote anti-smoking messaging in Indonesia. So sort of a combination between data analysis and health promotion, which I think is quite interesting. I have another student who's analysing COVID-19 hospital data, looking at severity of illness and how vaccination can impact that, you know, with an interest to looking at new variants are developing, and we think COVID is over in some ways, in other ways it's not yet over. So and other students are working with big Australian data, so, you know, linking data that is linked between the Medicare health system, the prescribing data from the pharmaceutical benefits scheme, and looking at different you know, patterns of health and medicine use in Australia. There are three I can think of off the top of my head.
Perfect. And again, anyone in the audience, if you've got any questions, please put them in the Q&A chat, and Matt is happy to answer those questions for you. But what makes the ANU different compared to other Australian universities that offer a Master of Public Health? So maybe what are our unique strengths and you know, the differences that we have in our program?
Yeah, so touched on this in the talk, but I think one of the key things that I've found looking at other MPHs and compared to the ANU's one is that research strength. I mean, I think we've mentioned this a few times, but it's a really important thing when you're studying something at a master's level, to have people who are on the cutting edge of what's going on in that discipline, but are also, you know, actively collecting data, analysing data, working with communities, you know, doing that frontline public health work at the same time that they're teaching you. So any examples that come up in the classroom are never from the textbook, they're always from, you know, the people's experience, and I think that's a real strength. In the Australian context, being in Canberra as well as the national capital, we also do work more closely with government and international organisations that are based in Canberra, which particularly when it comes to that internship area, for example, that also gives students a really good opportunity to work with those sorts of organisations that we work closely with.
Great. We do have a question here, and I think it's to do with cognate disciplines. So would you consider any other areas of previous studies, such as an MBA or a Bachelor in Business Management brackets sustainability development? So is this something we could consider for our program?
Yeah, so the list of cognate disciplines, they're not individual degrees, it's not a list of bachelor of this, bachelor of that. So there is some flexibility there that we can work with you to, particularly there's a cognate discipline called Studies of Human Society, that can include demography and economics and areas like that. So it would be on a case-by-case basis, and I won't give a direct answer now, but I'll say it wouldn't be a no, we could look at it, would be my answer. Yeah, look at individual cases. Yeah.
So we will be sharing Matt's email at the end of this presentation. So for those individual cases, definitely reach out, and I'm sure Matt will be able to provide any clarification that you may need.
Sure.
Great. Of course, our Master of Public Health program is a very small program at ANU. So can we just maybe talk about what the student experience is like, how they interact with the academic staff, how they interact with their peers in the classroom, maybe just give a little bit of insight into what it's actually like to study a Master of Public Health at ANU.
Sure. The key thing, I think, as you said, is it's a relatively small cohort. We usually have around 20 to 30 students each year. So the advantage of that is a very personalised teaching style, as in all of our lecturers and conveners are available to meet with students and have discussions about their work and their progress. Because it is not so big that's not feasible. We have students. We should ask a student as well about the student experience, but because that cohort size, the students all do get to know each other as well, and generally each year they set up some social interaction activities and things as well. But our ANU campus in general is not as big as some of the other universities. So, joining any of the clubs and societies and things like that is also, from my experience talking to students, has been a really worthwhile way to get into the student life at ANU.
Great. Now, we don't have any questions coming through, so I do have a question that's just come through. The question is, should I have a research proposal ready to apply for the advanced option, or is this something I can develop once I've enrolled into the program?
Yeah, so no, you do not have to. You don't have to have your project developed. In fact, generally, projects are developed once you arrive and you've done some of your coursework subjects. Then you get to know some of the lecturers and academic staff in the centre, and you can start thinking about who you're interested in working with and learn more about what each academic is specialising in or doing research in. So no, you don't need to develop a project before you come. Another point, there's probably a bit too much detail, but we do also have a research design and methods course that you need to do in the semester before you do the research project. And often through doing that course is where you actually develop the proposal and project itself for what you will do the following semester.
We will leave just a few more minutes for any last minute questions to come through. But Matt, what advice do you have for future students considering a Master of Public Health, whether it's in how they do the application or what they should be kind of arriving with coming into the program. So what's your advice for students considering the program?
Well, I think I've said this about 3 times through this talk, but public health is a very broad discipline. So firstly, don't ever think because you haven't done, really health related topics before that that this degree wouldn't be for you. We start with assuming you don't know anything about public health. So, some people may come from a Bachelor of Public Health background or health sciences. That's fine as well. So rather than saying what they should do before, I'm saying what not to worry about before you start an MPH. But I think, trying to learn a little bit about what public health is before you start can be helpful. But I mean, to be honest, I think, over the last 5 years for all of us, we've all become a bit more familiar with what public health is through all of us living through a pandemic and things like that. So I think that has probably helped a lot of our students be in the mindset more to understand how epidemiology works and how it impacts on society and all the culture and politics and all the things that lie behind public health have become a bit more obvious. So I don't know if that quite answers your question, but that's a little something to think about for potential students.
Yeah, no, that's fantastic. So we don't have any other questions coming in from the audience, which is totally fine. It just means that you've covered all the bases and given us a very good overview on what public health is. I am just going to quickly re-share my screen with our contact details. So just go back into that. So we would like to thank everyone for joining the webinar today. We hope you found it useful and informative. You can reach out to Matt directly as well for any course-related questions. If you've got a question about a potential research area that you would like to explore or anything like that, then Matt is definitely available for you to contact as well. I'd like to extend a huge thank you to Matthew for hosting this webinar today and for telling us all about public health at the ANU. And we hope to see many of you on campus soon. Thank you so much.
Thanks, everyone.
Thank you.
Bye.